Hello. Hello, everybody. Welcome to today's live Q&A. My name is Jo. So I am from Specialist Language Courses. I'm senior teacher there, and I'm very pleased to welcome you to today's session. So do say hello in the comments and where you are at the moment. And does anybody have their test coming up? Please let me know. Hello. Okay, we've got people in Nepal. Great. Fabulous. Okay, so today I'm answering all questions OET. So if you have a question for me, please pop into the chat, into the comments, and I will do my best to answer as many as I can. Okie dokie. All right, so let's have a little look. So the first question we've got from Gibran. Hi, Gibran. How to manage the time in reading part A? It's very difficult. Yes, it is. So reading A, the actual activities are not that hard. I mean, you can find it if you have lots and lots of time. However, the challenge of reading A is the time. You have 20 questions and only 15 minutes to do it. So that is less than 1 minute per question. So the time pressure is what is the challenge there. So how can you manage your time? Well, you need to go, 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 go. Okay. So practice going as fast as possible. Okay. Other tips for saving time is use, obviously, the correct strategies. So let's just recap those. So the first thing you need to know is do not read the texts. I know it sounds a little bit silly not to read the text in a reading exam, but I think you need to remember that reading A is not testing your ability to read for detailed information and detailed understanding. It's testing your ability to find information fast. So that's what you have to do, and you have to use your skimming and scanning strategy skills in order to do this. So the first thing you need to do is just have a quick glance, a skim over the text, just to get a general idea about what kind of information is presented in each text. Is it information on dosages? Is it a description, like a definition of the medical condition, perhaps? Is it how to manage something? Okay, are there any subheadings? What kind of information is in there? Is it mostly numbers, for example, dosages? Or if it's management, is it mainly verbs? How to do this? Avoid this, take off this, administer this. Yeah, so really take a minute or two to just notice what kind of information is in each text, and the kind, and what it's about. The next thing to do is do the matching task first. Many people have been saying, there's lots of different forums out there. People are sharing ideas that perhaps do the matching task last. I always think, no, do it first. One, because it's easy. It's an easy 7 points that you can get very, very quickly. Because imagine if you leave it to the end and you run out of time, you've got 7 easy points. Okay, so that you might have missed. Get those points quickly. You don't need to actually find the answers. You just need to say which text the answer would be in. So don't actually find the answers, only check if you need to. So do the matching task in a couple of minutes, and then you move on to the other task. Now for the short answer questions and the sentence completion, it's the same strategy. You've got 3 things to do. look at the question or the sentence, okay, and find out what information you're looking for. Yeah, what's the answer going to be? Is it a medication, a body part, what, a number, what? Okay. Number 2, what keywords in the question or sentence are gonna help you find the answer? Underline them. And number 3, which text is the answer going to be in? A, B, C, D. So 3 things. What am I looking for? What words and phrases will help me find the answer? What text am I going to look at? Then scan that text, find the answer, write it down, and move on straight away. You do not have any time to waste. You've just got to go, 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 go. If you cannot find the answer straight away, move on. You can always come back to it later if you have time. So this really is the best way to approach reading A so that you can maximize that 15 minutes and find the information fast. Okay. So let's have a little look. What else have we got here? We've got some more questions. So yeah, if you do have any questions, please pop them into the comments and I'll get through as many as I can. Okay. Hi. Bulai in Worcester. Great. I was in Worcester last month. Okay. 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 Kevin's written, I took the exam on the 14th of October, but I'm not confident enough for my speaking. My interlocutor was not cooperative. Okay. Yes. So hi, Kevin. I'm sorry that you don't feel confident about your speaking exam. Perhaps you didn't do as badly as you thought. I think speaking, there is always going to be some kind of resistance from the interlocutor or the patient or carer, if you will. Always expect some sort of challenge. And what I mean by challenge is perhaps they're not going to follow your advice straight away. So you suggest some lifestyle changes, and then no, 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 I don't have time to cook. Oh no, I don't like exercise. They're always going to be a little bit challenging. So this might mean they might not follow your advice, or they might be so worried that they don't listen to your explanation of the treatment. So it's your job to use effective communication and strategies in order to get them to take your advice or get them to focus on the treatment. So the way to do this is to be firm but empathetic. So always demonstrate empathy first. So let's say, for example, the patient not doesn't want to follow your lifestyle changes suggestions. Yes. So empathetic. I understand it's really hard to find time to cook healthy meals. However, it's really important that you make some changes to your diet. Having high fat and salt intake can increase your risk of heart disease. Yeah. So empathy first and then stress the importance. I understand, but the same for if someone's really, really worried and it's just, yeah, but I'm so worried. I'm so worried. You say, I understand you're worried. It's totally normal to feel this way. However, let's focus on what we can do now to treat your son. And we'll talk about future scarring later on. Yeah, so really, it's not what you say, it's how you say it. Okay. Okay, so some of you got exams in January, some of you got it this weekend. Yeah, okay, Nida, you got the exam on Saturday. Well, I hope you do well in the exam. Question about reading C. I get confused in 2 options, which I feel are correct, and normally choose the wrong one. Yeah, so I think with reading C, it's really, really hard. You're tired, it's coming to the end, and you've got all this complex language, and you've got it's really hard to understand sometimes what the options say. So if you've eliminated 2 options and you're left with two that could be the right answer, really look at what is the difference between those options. Yeah, what are they saying? Can you paraphrase it? And focus on the question. What is the question asking? Because maybe both options are mentioned in the text, but only one of them is answering the question. So really focus on the differences between the options. What is the question asking you? And then if you still don't know, think about the paragraph as a whole, okay? Because maybe it's not just one sentence mentioned in the paragraph. You need to understand what's the main idea presented in that paragraph. Okay, we've got a question here about writing from Baku. Hi, Baku. How long should be the introduction paragraph? Yeah, good question. So the first paragraph in OET writing, I like to call it the purpose paragraph, shouldn't be too long. It needs to clearly set out who you're writing about and why. What is the purpose of the letter? So I think 2 sentences is more than enough. 1 to 2, depending on how you express it. What you want to include in that is who you're writing about and what's the purpose of the letter. So who are you writing about? What's the context? How are you connected to them? Have they been visiting your GP surgery for several months for treatment of their diabetes? Or, have they just presented today? Are you a community nurse who's been visiting them at home? Are they in hospital? Are they being discharged? What's the context? Yeah, the situation. So name, context, and then purpose of the letter. Why are you writing? What does the patient need from the reader? Yeah? Is it ongoing care after discharge? Is it further management and advice for of their diabetes? Yeah, those are the 3 things you need to put in. The name of the patient, the context, so that could include the medical condition, or what's been happening recently, and the purpose of the letter. And it's a general purpose. You don't need to put all the specific details, just put, on requires ongoing care, requires further management, requires a definitive diagnosis and further advice, depending on the task. Okay? Okay. All right. So we've got a question here from Shraddha. Hi. Um, I'm going to take the exam, but my last mock test, it was difficult for me to get a pass mark at reading. We've also got someone else is asking, oh, what are the passing marks for reading and listening, please? We simply don't know. You don't know what the pass marks are because every test is slightly different because no one text is the same. OET do not tell anyone, providers, students, candidates, anyone, what the pass marks are for each individual test. They have not given that information to the public because each test could be slightly different. They use a complicated algorithm to calculate the scores. So what OET have said, though, if you are consistently getting over 30 marks in reading and listening, you have a good chance of taking the test and you should be ready to take it. Yeah, so that's kind of what you're aiming for is over 30. Okay, but maybe some will be more, some will be slightly less. Okay, I would say it's really important to maximize your points in part A of both listening and reading. Yeah. Reading is 20 out of 42 marks, so that's nearly half. So the more you get right in reading A, the less pressure for parts B and C. The same with listening. Listening A is 24 marks out of 42. So that is more than 50% of the marks. So again, really maximize your scores by using the strategies correctly. Um, which leads me to another question we've got from Hi Cynthia. She's asking, kindly help me with tips in listening part A. I'm having difficulty answering the questions. Yeah, listening A can be very difficult. There's quite a lot to write down within a short amount of time. So you have your 2 extracts, 2 consultations, and you need to complete 12 spaces for each extract. So really, really important for all listening parts, but particularly part A, You need to utilize the pre-listening time effectively. So use this time effectively. You only have 30 seconds, which is not very long at all. So you need to practice skim reading the notes quickly in 30 seconds. As soon as the test starts, you can start reading the notes. Yeah. So read the notes. You need to notice several things. So you need to read through all the notes, notice what kind of information is there. So are there any subheadings such as presenting symptoms, past medical history, description of pain, things like that. Okay. So that you know what kind of information is going to be talked about in consultation. You also need to notice the information that's already being given, okay, with no gaps, because that's going to help you keep your place and know what else is for. And of course, you have to notice the gaps. And as you're reading through, sort of think about what kind of information is going to complete those gaps. Am I listening for a medical condition? Is it going to be a body part? Things like that. Okay, so it's a difficult thing to do, so you do need to practice doing it. Practice the pre-listening time, so you're reading while thinking and noticing. Okay, and so if you do that successfully, you're better prepared for listening. Okay, to the audio and then writing the answers. So you'll know the structure, you'll know the information already provided, which can help you keep your place, and you'll be ready to write. Also, I think notice sometimes there are a few answers that come one after the other with no break. So be ready for those because you're going to have to write, write, write. You won't have any break time in between spaces. So do notice where you've got several answers one after another and be ready to write. Practice writing while listening. Yeah, you can listen to consultations online and just practice making notes. It's a difficult skill to do, but definitely make sure that you maximize that 30 seconds by being ready, reading through the notes first, predicting. Okay. So, question, can we underline the words in the question paper, especially in reading and listening? Can it affect my evaluation? No, it will not affect your evaluation at all. Please do underline words. It will help you focus. Yeah, underline keywords absolutely fine. It's not going to affect your score at all. I strongly recommend you do underline things. Okay. Fatima's asking, do you share or circle answer options? So with the answer options for parts B and C in reading and listening, you colour in the circle with a pencil. Okay, so do choose the OET website, the type of pencil that you need to take with you, and yet you colour in the circle. All right. Okay, so I've got a couple of questions about speaking. So we've got one is asking, could you explain speaking without introduction? I'm assuming speaking where you're not meeting the patient and that moment, you're in the middle of a consultation. Um, I think most of them usually are at the start of the consultation. But perhaps you've seen them before or you're coming back to them. I would just go straight into it. Yeah, so just be like, "Hi, it's Nurse Jo here again. I'm just here with your test results. Is it okay if I have a chat to you about them, please?" Something like that. Yes, you don't always need to say, "Hello, my name's Jo. I'm the nurse on duty today. Can you confirm your name and date of birth?" It's not necessary. I think sometimes you just go straight in. Okay. I've got a question from Ross Jomi. Hi. Could you please explain how to begin the home visit task in speaking? Well, Rosmi, it's very possible that you could be doing a home visit. This is both nursing and medicine. Um, so think about what you would do in real life. You would say who you are and why you come, yeah, and request permission to enter. So same thing. Hi, I'm Jo. I'm the community nurse. The doctor's asked me to come here and check your dressing. Is it okay if I come in? Something like that, yeah? Or, "Hi, I'm Dr. Jones. I'm just here to come in." um, uh, talk to you about your whatever upcoming operation. Okay, so that's how you would begin a home visit. Uh, um, role play. Okay. So question from Marari. Hello, Marari. Is it possible to prepare in 2 weeks? It's possible. I would strongly recommend doing more. So if you haven't booked your test, I'd recommend, you want really a good month, depending on your level as well. Um, if you don't know anything about the OET exam, I strongly recommend that you take much longer than 2 weeks because you really need to get to know the exam, learn the skills and strategies to use in the exam, develop those skills and strategies, practice using those strategies. However, if you only have 2 weeks left, then I think it's really important to just do what you can. Okay, so you can do some practice, review strategies and skills. Um, well, we've got a video on our YouTube channel. It's last minute preparation. Check that out. It's got some tips on the things you can do in the last few weeks before your exam. So have a little look at that. Okay, and a question from Jojo Thomas. Hi, Jojo Thomas. If my speaking happens at 4:30 p.m., can I greet the patient with good evening? I would probably say 4:30 is good afternoon. I think that would probably be more appropriate, or just say hello. You don't have need to say good afternoon or good evening. Yeah. Okay. So let me know. Oh, we've got a few more minutes left. Are there any questions? Please write your question in comments. Okay. And if you are preparing for OET, we've got lots and lots of courses that can help you on our website. So do check out our preparation courses. We've got Reach OET B. You can purchase um, those. We've got writing correction and we've got practice tests. So where you get feedback from our teachers. Okay. So any more questions before we finish? Let's have a little look. Oh, yes. Sorry, I missed this one. Hi, Sawali. How to crack reading part B. Yeah. A lot of people overlook reading part B. It's not given a lot of focus, but it is important. It is six valuable points in the reading paper. So the thing to remember for reading B is it could be asking you about the overall gist of the paragraph, the main idea of the paragraph. So you need to read the whole paragraph. You're not scanning in reading B, you're understanding main ideas. So I think the best strategy is look at the context. What kind of text is it? Is it a guideline, manual, what kind of thing? An email? Read the question, make sure you understand what it's asking you. If it's a statement, not a question, try turning it into a question. Then read the text. Don't look at the options yet because they might distract you. And you've got to read them again anyway when you're choosing the right one. So read the question, then read the text. Think, keeping the question in mind, and just sort of think about the main ideas presented in the paragraph. Then look at the options one by one, eliminate any obvious wrong ones, and choose the correct option. Remember, it must answer the question. So just because it's mentioned in the text doesn't mean it's the right answer. Yeah, so really important that you do um, focus on the question. Okay. Uh, okay, another question about if I get a grade B in 4 attempts, can I get the job? You have to look, it depends where you're applying to. Most bodies, accepting bodies, it depends. You don't say if you're a nurse or doctor. Um, for medicine, you need to get it in one sitting, I think. Pay at least, depending for the Um, GMC for nursing is over 2 attempts only with nothing under C plus. But it really depends what country, what what medical body you are trying to register with. So you can find more information out on their website, I would say. Okay. Listening part B and C strategies. Yeah, really important. Again, like listening A, it's really important that you use your pre-listening time effectively. So make sure that you have read through the question and options. So in part B, you get given the context and then you have about 15 seconds to read the question and option. Yeah, just each question. So one question about which is quite a lot of time. So make sure you understand the question, understand keywords in the options, notice the difference between them, and make sure you're ready to listen. Listen to all of the audio before you check your answer. Part C is slightly different. You have about 90 seconds to read 6 questions and options. So make sure you practice doing this so that you know what 90 seconds feels like and how fast you have to read. Again, make sure you understand the question, underline keywords if it helps you, notice the difference between the options. And I think, yeah, it's really hard to do this in under exam pressure, but I think um, it's really important to practice. Yeah, practice doing this in 90 seconds. Notice the structure as well. So you kind of, by reading through the questions and options, you have an idea of what the speaker is going to talk about in what order. And this can really help you if you lose your place, particularly in the presentation. The interview kind of helped a little bit by the interviewer's question. But yeah, do focus on using that pre-listening. Question from Mahamat, how can I approach reading A, challenging about the time? I did talk about this at the beginning of the live session, so when it finishes, it's gonna be on YouTube. Go back and watch the beginning. I talk quite detailed about how to approach reading A, so do watch from the beginning and you'll be able to get my tips on maximizing time. Okay. Right, I'm afraid that's all we've got time for. Thanks so much for joining me today. We'll be back here next month, same time, same place. Okay, so please do check out our courses that might help you on our website. And if you're not taking the exam before then, please join us next month. The same thing, any questions you have, you can ask us. You can always ask questions on our YouTube channel. We're always reviewing that and responding to questions. We're also live tomorrow on OET's YouTube channel. We are talking about how to give advice effectively. So that's 9 a.m. UK time. So do go on the OET YouTube channel to find out more information about that. Hope to see some of you there tomorrow for that. If you're taking the exam this Saturday, good luck. Remember the strategies, keep them in mind, stay focused, and don't panic. If you think you've done badly, you might not have. Okay, don't let it affect the rest of your performance. Okay. Hope everyone enjoys the rest of their week, and I'll see you soon. Take care, everybody.